Hi, my name is Stephanie Harris, and I'm here with my wife, Tanya Grubik. And we met about 5 years ago. When we met, it was one of those great moments where life just kind of stood still. I think that when you find your true love, you have those moments that essentially transcend reality, and that really was what it felt like for both of us. One of the things that we learned with Tanya is that where the Alzheimer's is affecting her brain is the frontal, parietal, and temporal lobes, and it's not affecting memory. So she was, the big indicator of her condition, if you will, was that she knew the answer, she just couldn't say the answer. She couldn't get the words to get to that answer. Her brain is still working, but it's just wasn't firing all together. And so within a few days, we're already seeing a radical improvement in just very basic markers that have been challenging her for a long time.
Most people take for granted how our brain works. It's actually more simplistic than we actually think. Our brain's there to take information from the environment in, process it, integrate it, and then create a response to that environment so that we can function normally in life. So it makes good sense as somebody who's a neuro rehabilitation specialist to look at the brain and figure out how it's perceiving the environment, how it's interpreting the environment, and how it's responding to the environment. And that's exactly what we did with Tanya. Physically, she's actually younger than her age, but mentally or cognitively, she's much older than her age. So we start looking at a mismatch there between what's actually occurring. So we know that the problem is in her brain. We did very specific tests with Tanya to look at her eye movement, to look at her inner ear function, to look at her balance, to look at her coordination, to look at her cognition, her ability to think, and we measured all of these things. So what we need to do is we need to use what's working in Tanya, which was her physical conditioning, which was her inner ear function, which were her eye movements, and then reprogram her brain or just train her brain, almost like a personal trainer, only a brain trainer would do, and then make it so that she can process her environment better and respond better to it.
To say that we're seeing a little bit of benefit is an understatement after just a few days. So it's a complement to what we're doing. It's something that we will integrate into the care that Tanya's getting going forward, and it's something that we finally feel like we have a little bit of hope where there is none. There's no information on how to get rehab and get care that affects a neurodegenerative disease. This actually gives us that hope that we've been looking for. This is a very hard thing for anyone to deal with. And one of the things that I pride myself on, and I think Tanya's like this, is that we don't think about tomorrow. We just do the best that we can do every day, and we don't think about where this is going to take her and us. And what the exercises and the work that she's done this week, it actually gives us, we feel like we can roll back the clock a little bit, and we can get her these, we can get her life back and get her some control back and get her some hope back. And it's very hard. This information isn't out there for people to have access to, but it gives us a bit of hope that we are doing something positive for her where there's no information. This is something that will give you that change that you need, that is going to help your quality of life. And that's what's needed, especially in Alzheimer's and any kind of cognitive decline.